So that's by way of introduction of Dr. Mermin. And really, I'm so glad that you were able to be here. We asked him to speak this morning. He couldn't be here, and of course we had great representation from the CDC, but he insisted when he got here that he was gonna, he would like to stop by and say a few words. So John, thank you for your leadership. Thank you for being here today and for everything that you do. Thanks.
First, I think the honorable effort of a last speaker, and I'll be under 5 minutes. The first, I wanted to thank Michael and Carl and Lindsay for arranging this and for inviting me, and also Chris and Erica for speaking earlier today. You know, I was struck first when Cam had mentioned about changing your mind and essentially the benefits of realizing that that times change and you have to make a difference for your ultimate goals. And I remember in about 20 years ago, I was working in HIV, and CDC published an article that in the New England Journal that actually mentioned that all patients in healthcare settings where inpatients had an undiagnosed rate of 1% or greater should be screened for HIV. And I wrote this scathing letter in response about, because I was working in West Africa at the time, about how not only is it documented that EIAs have terrible positive and negative predictor values, but Western blots are completely non-functional in Africa. And I really focused on all the negative aspects of this terrible recommendation. He hadn't even talked about Africa, but I just decided to spout this. Needless to say, this is now available on PubMed, embarrassingly enough. Within 5 years, I had started not only routine testing in all the major hospitals in Uganda, but had actually gone door to door and tested over 3 million people with over 96% uptake. And essentially realized, just eliminating the idea that people have to come to you for HIV testing, but that you should bring it to them. So I changed my mind. And I say that so I do respect that it is important to recognize that some of the real strong priorities that were important at the beginning of the epidemic, some of them are still here, and some of them aren't, and we need to kind of adapt to that. HIV prevention activities during sex don't make sense unless you know yourself and your partner's status. We have good data that over 60% of all gay men get their HIV infection from their regular partner. We have good data from a national survey of sex among all Americans that are modeled for all Americans from the survey, that 70% of adolescents used condoms the last time they had sex, but only 22% of women and 25% of all men. It turns out that you are twice as likely to use condoms with non-regular partners, and if you've had sex with your partner 10 times or more, you're 5 times less likely to use condoms. Why? No one uses condoms in the long term.